Yeah, I don't see lower, but do we have upper?
Last week, did we do the whole thing? Like,
Yeah.
or did we do?
She did lower. I think she did upper and lower.
Yeah, I did upper and lower, but it was focused on lower. And he has some good organs too, so yeah, this is a good cat.
The greater and
The rest of the momentum, everything.
Yeah, I got it.
yeah, the falciform ligament.
All right, so let's start with upper arteries, and then I'll do organs after. So obviously this is the heart. So off of the heart we find our aortic arch. It then splits into left subclavian, brachiocephalic. The thicker of the two is always brachiocephalic. If you can't see, it's okay. I'm gonna keep doing it over and over again. Okay. So left subclavian becomes left axillary, and then we have left brachial way out on the arm. See, this is where I would pin it, way out here. Axillary would be the middle portion, and then subclavian will be down here. All right. Then we have our left common carotid, right common carotid. We know these are the common carotids because the trachea, the windpipe, is right in the middle in between both. On the right side, remember it starts brachiocephalic, and then that splits into right subclavian. Right subclavian becomes right axillary, and then right axillary becomes right brachial. Here you can see subscapula. Okay? And that's it for the upper arteries. I'm gonna do it one more time. Aortic arch. Then we have a left subclavian, left axillary, left brachial, left common carotid artery, right common carotid artery, right subclavian, right axillary, right brachial. Okay. Okay, here's some lower arteries. So I'll just do the basics. So when we follow the aorta all the way down, it becomes the abdominal aorta. So it's this artery right in the middle that goes all the way down. All right, the first branch is the celiac branch, celiac artery, and then it splits into the mesenteric, superior mesenteric. Remember, there's two mesenterics. There's one superior that goes into the mesenteries. See how it leads to the mesentery proper? Following it down, we find, oh, the kidney's cut off. The kidney artery. Is it on the other side? Okay, it's right here.
Okay.
The artery leads to the kidney is called the what?
Renal.
So renal kidney. When you go all the way down, you find inferior mesenteric right here, leading into the colon. This is the colon, also known as the large intestine. Then you find iliolumbar. Iliolumbar is a small artery that's plaqued on the dorsal wall. All right, at this intersection, you'll find your external iliacs. External. So this would be our left or right? Left external iliac, right external iliac. Inside the external, you find the internals. So left internal iliac, right internal iliac. All right. I'm gonna go over the organs because this one, the ones at the thigh and they're not that good.
Wait. Okay, that's the left.
So the organs, diaphragm. This is diaphragm. It splits the thoracic cavity and the abdominal cavity. Okay, it's the split. This thick organ right here, see how thick it is the liver. Okay, liver. Inside the liver, you find the gallbladder. The gallbladder is the sac that holds bile. Okay, on the left side of the cat, you find its stomach. Also on the left side, you find the what? Spleen. Okay, this would be the greater omentum. Okay, it would hang like this and fold over all of the organs. If we have a greater omentum, we have lesser omentum. It's lesser because obviously it's smaller and it's more superior.
That's a good cat.
This is a good cat. All right. When you leave the stomach and you meet the small intestine, what does it look like that? You find the duodenum. It's the first part of the small intestine. You know it's the duodenum because it's the meeting between the stomach and the small intestine. You open up the small intestine, you find what?
Mesentery proper.
Mesentery
mesentery
prior.
proper.
Good. Leading it down, we're trying to find cecum. Cecum. Cecum is the hook, yeah. Why does it look like that? I'm trying to find the straight part of the intestine. Oh, there it is. So this is large intestine.
Yeah.
Cecum has to be at the tip. There we go. Cecum.
Cecum.
So you see how I found the large intestine, and then I followed it away to find cecum. Cecum is the hook. All right. So the end portion between the small, the large intestine and the small is ileum. It's just the end portion. The end portion of the small intestine. This is bladder. And I believe that's all the organs. Am I missing an organ?
Oh, Professor, you said about the aorta like that on the radio that until what part become like the.
Oh, what are the different regions of the aorta?
Yeah, and then where's like when because you said like until
Abdominal.
this part.
Oh,
is
okay.
abdomen-
So this would be the arch, and then if you follow it down, this is the aorta going down. Once it gets to this region, it becomes the abdominal aorta.
Okay,
So it's the
right.
same aorta, it's just different names because it's different regions.
Okay,
Okay.
so right out like.
So this whole thing is the aorta still,
Okay.
the center.
So
Mhm.
so it's kind of so it's like the going from the auxiliary to the brachial.
What do you mean?
It's all the same.
It's
like
all
one,
the same.
but different
When it's
sections have
divided,
different
Different
names.
sections.
Over here, pretty much. When it divides
Mhm.
to the.
Once you come into the abdominal cavity, it's the abdominal aorta. So I could tag it up here and it'll be called the arch. If I tag it down here, it's the abdominal aorta.
Okay, so any place around here is the arch. Any place around here is the abdomen.
Well, the arch is just on the heart.
Okay.
So this part right here
Okay, so this merges. But any place in the abdominal.
is the abdominal aorta.
Oh,
Yes.
Mhm. In what situation would it be the descending
Yes.
aorta then?
You're not gonna ask her?
I'm not gonna ask that, but it would be right here
Okay.
when it goes down.
Okay, so I want to make sure 'cause I thought that was
The reason I don't ask is because we don't focus on the heart on the cat. Okay, so it would be near the heart. So
Okay.
just know aortic arch and abdominal aorta.
Okay, so this is just for the cat heart, cat aorta, but for the human
Yeah,
aorta.
human we have a descending.
Okay. No, fair enough, because they stand. They're on their feet.
All right, so do you guys want me to do it again on this cat? Because this is a pretty good cat. And then I'll look at that cat. So anybody that didn't see